Hello, my name is Mackenzie Pate, and this is Affirm Youth, Increasing Wellness and Resilience for LGBTQ plus adolescents. So we are going to jump straight into it today. So I wanted to give a brief recap in case this is a new concept or one that you don't spend a ton of time working with, which is the difference between sexual orientation and gender identity. This is a good introduction to talking about working with this specific youth population. And my favorite analogy to discuss the differences in sexual orientation and gender is the prom night example. So both of these things can be best understood through their three spheres, which is attraction, behavior, and identity. So sexual orientation, that attraction, who do I want to go to the prom with? Behavior, who am I actually going to go to the prom with? And identity, what do I tell others about my date to the prom? So maybe I want to go to the prom with Susie, but I feel some kind of way about telling others that Susie's my date to the prom. So I'm actually going to go with Johnny, and vice versa. Maybe I want to go to the prom with Susie. I actually do go to the prom with Susie, and I tell Susie, or I tell others that I'm on a date with Susie at the prom. So that's sexual orientation. And then gender identity, similar, related, but not the same. That attraction, when I'm shopping for my prom outfit, what do I want to be wearing? What catches my eye? Behavior, what will I actually wear? And then identity, how would I describe that prom outfit or that choice to others? So maybe I want to wear a beautiful gown, but I don't want to tell people that what this gown may say about me. So I actually will wear a suit. Or vice versa. Maybe I really want to wear a suit. I feel incredible in it. I actually do wear the suit. And I tell other people that I'm really living my masked life and I look dapper in my suit. So that's kind of the overview of the difference between sexual orientation and gender identity. So working with youth, you might hear this slang term, the alphabet mafia. I put that in here just so it doesn't catch you off guard if you ever do happen to hear it. But you more likely have heard the long acronym LGBTQIA plus, or sometimes IA2S plus. And this is what these letters stand for: lesbian, gay, bisexual, transgender, queer, and sometimes that Q people use to do questioning instead of queer, intersex, asexual, and then 2S is two-spirit. Some of these words are sexual orientation words, such as lesbian, gay, bisexual, queer, and asexual. Some of them are gender identity words, such as transgender, intersex, and two-spirit. It's good to note that two-spirit is specifically for Indigenous people. And this is a gender identity term that has been around for a long time, is not new. It is culturally relevant for Indigenous people. Some other identity words that you might encounter but don't get put into that acronym are pansexual, non-binary, gender fluid, polyamorous, genderqueer, agender, demisexual. If your head is spinning, please take a moment, breathe. It might seem like a lot. This might seem like, what are all these words? We didn't have all this a long time ago. And the thing is, you did. These are identity words. The words themselves might be new, or they might be new to you, but these ways of being and identifying have always been around. People just haven't had the shared language to discuss them. If you want to learn more about what each of these identity words means or the history of them, a good resource is the Human Rights Campaign. They go into all of that. That would be a great jumping off point to learn more about sexual orientation, identities, or gender identities. You're also welcome to come speak to me directly. I'm happy to talk about this if you'd like to learn more. So working with queer adolescents specifically, and I'm going to use that acronym LGBTQIA plus and queer interchangeably because that's what the community is doing. So when we think about working with this population of youth and young people, they have some special concerns. Namely, Bullying and social isolation from their peers and lack of family support are the two big ones we think about a lot. But there's also dysphoria, feeling uncomfortable in your skin to a point that it causes you significant distress, a lack of access to gender or identity affirming clothes or personal items. And I use personal items as kind of an umbrella, but this could be the decor that they put in their room or how they decorate their locker or the bag or backpacks they use, just any of the little things that we all use to kind of symbol and reference who we are and how we feel about ourselves. Healthcare is a big one. We mostly are talking and thinking right now about healthcare for transgender or non-binary youth, but inaccessible or unaffirming healthcare is a big problem for any adolescent, or it could be a big problem for any adolescent in the queer community. An overrepresentation in the foster care system, and an increased risk of homelessness. We think about these a lot in the child welfare system because they are more likely to be the way that we begin to interface with this youth population. Um, all of these things can contribute to poor mental health, and poor mental health can affect all of these things. So that's what we're going to mainly think about today. Depression, anxiety, suicidality, just those general poor mental health conditions. So let's talk about AFFIRM Youth. So this is the intervention program that we're going to focus on for the rest of this presentation. So the goals of this intervention are to reduce poor mental health, reduce the impact of LGBTQ plus specific stress, so the specific life stressors that happen as a result of being part of this population, and to increase these youth's coping skills. So how does this program work? Well, it's tailored specifically to the experiences of queer youth. That's important. It is a cognitive behavioral therapy group intervention program, and it's a trauma-informed approach. This is really significant because a lot of these youth will experience trauma that is significantly impacted by their identity in this group. So this program lasts for a total of 8 sessions, about 90 minutes each week, and this can be done in person or virtually. That's great because it makes it more accessible. The training materials for practitioners are offered in English, Spanish, and Dutch, which means if you are working with clients who speak Spanish or Dutch, this program, you can do it with them as long as you are competent to provide practice in those languages. And then they have implementation manuals and training. So outside of the research literature that's been done on this program, they have specific manuals and trainings that you can read and attend to learn how to provide this program. So how does it actually work? What do these 8 sessions look like? So first is an overview of CBT, LGBTQ plus identities, and what it's like to experience minority stress. Then you'll discuss understanding the impact of anti-LGBTQ plus attitudes or sentiments. So you might refer to these as homophobic or transphobic sentiments. Exploring with youth how their thoughts impact their feelings, then how their thoughts can be used to change their feelings. Then you'll work on linking their feelings to actions. So this is really where the meat of that CBT is. Then finally, you're going to challenge counterproductive thoughts. This is a big turning point in the program. And then finally, to conclude, you're going to work with them to develop safer, more supportive social networks. And then just tying the whole program together to get them prepared to take it out, to take these coping skills into the rest of their lives with them. So the California Evidence-Based Clearinghouse rates this program through 2 main topics, which is depression treatment and their SOGI programs. If you've never seen the SOGI acronym, it stands for Sexual Orientation and Gender Identity Expression. When you look at it, you can kind of quickly remember SOGI, LGBT, SOGI, LGBT, because usually we're talking about that population. So for their scientific rating in both of these areas, they give it a 3, which means that there's promising research evidence, but there is not the same wealth of research that's been done on other standard treatments. And then its relevance to child welfare specifically is a medium, right? Like this is relevant to child welfare because in the child welfare system, you are likely to at some point work with this population, but you may not, depending on the sphere of practice that you're in. So it's a medium as far as the relevance rating. So let's talk about some of the pros and cons or the strengths and limitations of implementing this within your child welfare agency. So the strengths, This is a fairly easy program to implement. It doesn't require a ton of materials, just basic arts and crafts supplies, and then the room to conduct the group session. And if you're going to do this in person, or the technology supplies if you're going to do it virtually. It's time limited. That makes it really easy to begin, complete, and then finish. And then if this is going to be an ongoing thing, you can find a new group of participants. So I feel that the time constrained aspect of the program is a strength. Then it's trauma informed and it promotes resilience. That is a big strength, both for you as a practitioner to become competent in these areas of practice, and also for the clients who are affected by it. Let's talk about the limitations, because there are some. First is agency support. Your agency might not support facilitating a program like this if there are attitudes against this population, or if there is a fear about the funding sources that could become unstable if you're seen overtly working with this population. Then there's the availability of culturally competent providers. If you don't have a provider in your agency who is competent to work with queer youth, perhaps it's worth finding someone who wants to become competent and training them up and through professional development, or finding another practitioner outside of your agency who could provide this. Then there's the possible legal limitations. Different states across the country are moving in peculiar ways regarding sexual orientation and gender identity minority youth. Alabama is one of those where healthcare specifically is pretty inaccessible for transgender and non-binary youth. And so an agency would need to be aware of some of the legal limitations that might exist. But this is somewhere where more advocacy needs to be done from social workers and child welfare practitioners to support these youth, because they're there and we need to be available to support them. So how does this fit into our ongoing commitment to evidence-based practices within our agency? So first, as you know, we're doing an audit of agency policies and practices. This is done in collaboration throughout our entire agency. We're doing this from a top-down approach, and we're going to gradually implement these changes, okay? So why is this being done? Well, it increases our credibility with our clients, with our community, and to ourselves, and it reduces our liability risks. In these really turbulent times where the microscope is being put on LGBTQ plus youth, LGBTQ plus people, and social service organizations and policies, we really need to be sure that we are practicing with credibility and that we are reducing our own liability. This is for our client safety and for our long-term stability. Then, as you know, we're doing our ongoing education regarding EBPs, evidence-based practices, so you can come to more professional development opportunities such as this, which is our Lunch and Learns, or you can talk to your supervisor about how to incorporate evidence-based practices and really fine-tuning, making sure that your programs are supported through evidence as part of your own professional growth and opportunities plan. And this is important because it makes you a more competent practitioner and it makes our agency practice more competently. That's really, I just can't emphasize how important that is for our clients and for ourselves. So these are the sources that I used in today's presentation. You're going to get a copy of this when I send it out, but feel free to snap a picture of this if you want to learn more about these in your own time. And thank you so much for coming to today's session. I have enjoyed having you. If you have any questions, please feel free to reach out to me directly. My email is on the screen. I'd love to talk to you more about this topic, and have a great day.